Now it's time for Cleared to Play. Take you inside the tent to get you updated on the latest injuries in the Bay. Proud to partner with UCSF Health on this segment and bring in Professor and Chief of Sports Medicine at UCSF. That is Dr. Brian Feeley. Hello and good morning, Doc.
Good morning to you guys.
Glad to have you on a time where some very big names are going through some things for sure. Our first question is about Brock Purdy. So the fact that nothing has happened yet, but all of the indications from the 49ers are still that it's the repair, not reconstruction. What is your read on this? Does it make sense that Brock has not had the procedure yet?
Totally. I think there's no real rush to doing the procedure because if you look at it in a few different ways, first of all, it's not a black and white area where we can say absolutely he's a professional baseball player. He's had chronic elbow pain, and now he tore his ulnar collateral ligament. He needs surgery. He's going to be out for 15 months. The reality is this is a pretty uncommon injury for quarterbacks. There's only been about 15 in the last 15 years, and most of them were actually managed without surgery. So this repair is something that's relatively new, and it makes sense that he doesn't want to rush into it, even though every indication is that's what he is going to do. When you look at the timing of it, too, waiting a week or two now still gets him back in training camp if he goes the 6-month route. If his elbow all of a sudden started feeling great and he decided to treat it non-operatively, he's not lost any time. And if he does the full reconstruction, he's going to miss next season anyway. So it really isn't changing anything to allow him to take his time and make an informed decision just like the rest of us would if we had an injury to our body.
Is there any potential for complications to arise once they get inside the elbow? In other words, can they see through the MRI exactly what needs to be done before they go in there and cut him open?
Yeah, that's a great question. And I think for his surgeons, just like all of us, most of the time the MRI is extremely accurate, but we're always going to have a backup plan. So for this, for instance, if they're going in with a plan on repair, they're going to have all the reconstruction stuff available just in case things look different than the MRI. For the most part, I would say probably 90 to 95% of the time for something like this, an MRI is going to give us the information we need and we don't change plans, but we always have a backup.
Doc, I've heard this out there and I wonder, a repair versus total reconstruction, is there any difference in the risk to future injury after that? Like, in other words, is the reconstructive, is that stronger in the future than a repair would be?
Yeah, it's a great question. We don't have great head-to-head data, but you're also really you're comparing apples to oranges. When we're doing a reconstruction, the ligament is already usually stretched out and shredded, and we wouldn't want to do a repair in those situations. So I think when you look at best-case scenario, when you look at biomechanics studies, they are going to head-to-head behave similarly and be able to take all the torque that you need to throw a football. Maybe a little bit different for Major League Baseball players, but for football players, it should be totally fine.
Let's turn our attention to Steph Curry and a knee injury that brought ligaments to all of us that we didn't even know we had, Doc. What is the nature of the ligament damage that Steph Curry sustained, and how is this different from a garden variety MCL injury?
Yeah, I think that's a great question. I think my colleague, Dr. Pandya, explained it great a couple nights ago. But basically, if you feel the top outside of your knee, that's the top of the fibula. And the ligaments in between the tibia and the fibula at the top are pretty stiff. They give you a lot of stability. But that blow to the outside of the knee can cause a strain in that area, very similar to the type of strain that you see for an MCL, just located more on the outside of the knee. Usually happens with a little bit more of a torque to the foot rather than a direct blow. The reality is for athletes, we don't have a great timetable for these because they're under-recognized. We don't see it nearly as often as we do for MCL strains. But I think the assumption would be that as he starts to feel better, this would take a similar time course, like looking at 2 to 3 weeks of rest and recovery, then starting to test it, see how he feels, and then reevaluating at that point. And that reevaluation is really important because he's got to feel totally stable around his knee to be able to get back in play.
Doc Feeley with us, cleared to play. Doc, 8 weeks almost to the day after Jimmy Garoppolo broke his foot, that came the NFC Championship game. And now there's the thought that maybe the 49ers were hopeful that he could get out there. An 8-week timetable on that injury. A, is it realistic to play? And B, if he had played, what might that have looked like?
Yeah, I think looking back when he first was injured, they were saying out for the season, missing start of the second year or start of the next year. And then you start looking at, well, maybe he can come back and play possibly, or at least he doesn't need surgery. 8 weeks would be among the fastest people ever to come back. And the idea that he could plant and throw effectively, I think that would have been a hard sell. And I think the risk really is if he plants awkwardly and then needs surgery, that could be a disaster for his foot, his career, his productivity for next year. So I think they did everything right. I would imagine that it would have been almost a miracle for him to get back and play. And he wouldn't have played at the level that they needed him to play at.
Doc, great stuff. Those are the answers we were looking for, man. Thank you so much.
All right. Have a great day.
You too, Doc. Great